All right. Yeah. Welcome, everyone, to the Advocacy for Health and Wellness panel. We're excited to be a part of Health Professions Week and to be able to tell you a bit more about how you can be involved to advocate for health and wellness and your respective health professions. I'm off camera, although I'm here, but we couldn't get everybody in the frame, and so I'll stay to the side here. We have a series of 5 to 6 questions for the panelists, but at any time, you can submit a question by adding them to the chat box. It should be an orange icon at the bottom of your screen. We'll leave plenty of time at the end of the planned questions so that the panel can answer a few questions from the audience as well. So let's get started. I'm here today with Ann Dermody, Libby O'Hare, and Dora Hughes. I am Tony Mazzacci. I'm the Senior Director for Policy and Research at the Association of Schools and Programs of Public Health. Ann, Libby, and Dora, would you each of you mind introducing yourself and giving a brief description of what you do?
Sure, I can kick it off. So great to be here, Tony. Thank you for having us. I am the Content Marketing Director for CQ and FiscoNote. And CQ, for anyone who doesn't know, is a legislative tracking and news and analysis and advocacy platform technology company. So I'm specifically involved with the advocacy side of the house. So we have 2,000 clients who use our advocacy platforms, and they range from large trade associations all the way down to very small nonprofits. From that core group, obviously it's a large group, we can kind of see where trends are going in advocacy, specifically, you know, what people are doing, what kind of campaigns they're working on, whether they're using more social media, whether they're, you know, using less email, all of that kind of good stuff. We don't have students per se as clients, but we do, I would say, have a finger on the pulse of kind of what's happening in advocacy, and you know, looking forward to sharing hopefully some of that information with you as we go on.
Thank you. I'll go next. My name is Dora Hughes. By background, I'm a physician, and I also have a master's in public health. Currently, I am an associate research professor at the George Washington University Milken Institute School of Public Health, Department of Health Policy and Management. I know that is a bit of a mouthful there. My area of work is focusing on social determinants of health. And you might say, well, what is that, social determinants of health? Those are non-clinical factors that impact our patients' health. And as one example is food. And we know that children, for example, who live in food deserts or areas where there's not enough grocery stores or other markets may, in many cases, have a higher risk of becoming obese. And that's because they have to rely on junk food, less nutritious food that's often much cheaper. And so when we think about how can we improve the food offerings, how can we improve access to food so that children can become healthier on the prevention side. And then on the other side, we know, as one example, patients with diabetes who are poor and run out of their food stamps are 30% more likely to be hospitalized for low blood sugar at the end of the month. And so then you have on the opposite side, how can we think of food as a treatment for patients with diabetes who don't have access to food? That food is a social determinant of health. And there's plenty of other examples. We can think of transportation. People who rely on the bus service are twice as likely to miss their appointments as those that have good transportation. If we think about housing, those who are homeless are significantly more likely to be admitted to the emergency room and to the hospital. Because how do you manage your heart condition if you don't have a safe place to stay? The list goes on, but the exciting thing for those of us who are working in this area is that medical providers, medical institutions, professionals are increasingly realizing that the best way to improve our patients' health is by tackling social determinants of health and making sure that they have all the services they need to optimize their health. And then just before this, I work mostly in government. I work in the United States Senate for many years for Senator Kennedy from Massachusetts, and for then Senator Barack Obama from Illinois. After that, I had the pleasure of working in the first term of the Obama administration in the Department of Health and Human Services. And so I'm looking forward to this conversation and happy to address any questions that that you have later.
Hi, everyone. My name is Libby O'Hare. It's a pleasure to be speaking with you all this morning. So I work at a government relations and consulting firm called Lewis Burke Associates. We focus exclusively on research, science, and education. Within that kind of broad bucket of interest, I particularly focus on advocating for robust funding at the National Institutes of Health, or the NIH, which many of you may know is the nation's sort of primary means of investing in basic biomedical research. The NIH funds much of the research that occurs at universities around the country in that area of basic biomedical research. I came to sort of the advocacy world, the science policy world, from a bit of a different background. I actually am trained as a neuroscientist. I got my PhD from UCLA in neuroscience about 10 years ago, when I was both in college and even really before college. I've been interested in science since I was quite young. Became passionate about neuroscience and really started to focus my efforts in my career to getting that PhD. During my time in grad school, I really started to get more interested in the role that science plays in society and advocacy and things like that. And it seemed that the career path for me of going into academia and being a academic researcher wasn't the best way that I could benefit my field and could benefit science more generally. So after I completed my PhD, I came to Washington on a policy fellowship that's designed for scientists that want to get into government and into science policy and advocacy. I ended up working in the U.S. House of Representatives for 3 years, where I worked on a wide variety of issues, including healthcare issues, science issues, things like that. I then spent 3 years at an organization called the National Academy of Sciences, which is based here in Washington, and is a body of experts that really helps to provide the federal government and Congress and the agencies with expert advice on any number of scientific and technical issues, including healthcare and medicine and those kinds of things. And so then for the last 3 years or so, I've been at Lewis Burke Associates, which again is that government relations firm where we focus on supporting universities. So.
Great, thank you. Libby jumped in and told us how she got involved in health and wellness policy and advocacy. Dora and Ann, could you tell us how you got to where you are today?
Oh, sure. I talked a little bit about my background and the different positions that I've had. I didn't talk about how I landed in policy in the first place, which I think is what Tony is pointing out. In part, it was during my clinical residency while I was training to become a practicing physician. And I had a number of encounters that were truly unsettling and disturbing in so many different ways. I remember the first time, and there were many times, for example, I saw a patient discharged from the hospital straight to the streets. It was an elderly woman. She had no house. The shelters were full. And we sent her out to the streets from the emergency. I remember the time that a patient confided in me that she didn't want to leave the hospital because she had no heat in her house. And everyone can imagine in Boston, Massachusetts, not having heat. I mean, that is just not a viable proposition for someone who's been in the hospital for a week for congestive heart failure. I remember patients who couldn't take their pills because they didn't have money to buy them. So it's because of these firsthand experiences with patients, with the common theme of poverty and lack of access, that started me towards thinking about policy. How could I help these issues for all patients, in addition to helping one patient at a time? And that in many ways helped to spark my interest in policy. Took advantage of a fellowship in minority health policy, also in Boston, and that started my career as I've described previously.
Right.
Okay, and so my background is in journalism, and I started out as a news reporter many years ago. Some politics reporting. You might can tell from my accent, I'm not from DC originally, or from Ireland. And when I moved to the States and moved to DC in particular, you know, the industry of this town obviously is politics and government. And so that became more of an interest of mine. And when I moved from journalism to content marketing, and for anybody who's not familiar with that term, it's basically creating resources and educational materials and things online so that when people Google for certain things, they will find those resources. And so when I started at CQ, I was sort of mandated with creating a resource center for folks in government relations and in advocacy. And I guess my interest is if we think of sort of you know, connecting people to their governments, I like to think of advocacy as sort of, you know, making those governments listen and making maybe bringing influence so that they change their minds on certain things. And so that's kind of my interest and my background. I would say it comes from a very sort of inform the people sort of motivation. And I think you can do that through advocacy in a very kind of strong way.
Great, great. What do you think is the biggest misconception or barrier that young people might have regarding policy and advocacy?
Well, I can jump in there. I think, you know, we wrote a piece on this not too long ago about sort of the perception that millennials particularly are lazy and they won't get out there and vote. And I think sometimes they're hampered a little by their, by feeling that they have to be part of a much bigger organization in order to make a difference. I think there's a real, you know, if you look at probably the biggest, I don't want to call it necessarily a lobbying group, but certainly the most influential group in DC and in the wider US is AARP. And for anyone who's not familiar with AARP, it's an organization that has 50 million members of folks over the age of 50. Anybody over the age of 50 can be a member. And I think it's like $50 for the year or something. And they have this enormously influential power when it comes to advocacy on the Hill and in policy and in lots of different ways. And I was just looking up some statistics, and as of October 2018, there are 19.5 million students registered in colleges and universities throughout the US. So for anyone to argue that that's not a huge, potentially huge lobbying group, if they could just mobilize together in some way, it really is, you know. And the one thing we know from above all else is that lawmakers will listen to constituents. So if you're over 18, your vote counts very much, whether you're 18 or 19 or 99. And so I think this idea that this one vote or your little vote doesn't matter is absolutabsolutely not true. And so I think getting involved in anything that helps to amplify that, particularly in this world of social media where younger folks have just got their fingers on that pulse. I think you can get involved in any way, but the very first one, and on a historic day like today, is get out there and vote. So I would say that's very much your very first advocacy action is to go out there and vote, whoever you're voting for.
Great, thank you, Anne. Dora and Libby, do you have anything you'd like to add?
But you asked about a barrier misconception, and one that I commonly encounter for students in the earlier career is they ask, which career path should I take? Should I go to law school? Should I go to business school? Should I get my PhD in science? And I think what you're seeing from this panel is that it really doesn't matter. Policy, it relies heavily on the law. So if you go in the law school, then maybe you'll help to draft legislation or rules or regulations for the nation. If you go to healthcare, become a physician or get a master's in public health or become a nurse, again, you will be helping to shape the health policies and programs in the nation. If you're a teacher, education policy is huge. And so my point is, and I won't belabor it, is that whatever career path you choose to follow, there will absolutely be opportunities for you to become involved in policy in a very meaningful way. And certainly in DC, there's no better poster child for opportunities to get involved in policy at the federal level. So that's one of the misperceptions I hear about quite often.
I'll just add quickly, I think both of those are really great responses. I know we have a number of folks participating this morning that are in high school or maybe in early stages of college. And I think one misperception that I've experienced and heard from folks is that they're quote too young, or they're not far enough along in their career, whether that be academic or professional. And I think that early on, passion is the most important thing to have, and that there's plenty of time to get experience. There are always going to be people who are the experts on content that can help you. And really early on, passion is really important. So.
Great, those were all great answers. I would only add, as the chief lobbyist for the public health schools, that there is a perception that money controls everything. And there's not a lot of financial resources behind public health. But what we do bring to the table is passion, as Libby said, but also being able to marry both data and a narrative to provide a factual basis to support our policy positions. And facts do matter on the Hill, and with committees and with Congress and with parts of the administration. And so money doesn't control everything. Your voice can still be very actively heard if your arguments are solid, logical, and we find it's most effective if you marry both data and a powerful narrative together. So I'll move on to another question that we both had from listeners as well as from our script, was what you might recommend for young students to learn more about policy and how to get involved. Are there ready resources that you would recommend?
Well, certainly I can speak to here in DC, but I think it's true for every state. There are often summer internships that you can apply for, where you could work in your member's office or in the Senate or the House or with some of the federal agencies. And again, those are open for students sometimes, certainly on the Hill, as early as high school. So that's one example. I would also encourage you to look at the professional societies. Again, on the health side, whether it's AARP or if it's the American Diabetes Association or American Heart Association, or there's an American Medical Student Association, AMSA. Again, they all have opportunities for you to get involved, whether in person during the summer or during school breaks, or remotely through participating in certain events or projects. And so that's one way that I think that you can get good exposure early on. It also helps to enhance your resume when you apply to college or to grad school. Say that this is an issue that I pursued and have successfully participated in. So I think for a number of reasons, it would make sense to seek out these opportunities.
And I'll just add to that too, that a lot of those associations and entities that Dora just mentioned have, electronic newsletters that come out periodically. Of course, free to sign up for. Signing up for things like that where you may have an interest in an area, getting that content delivered to your email, certainly reading, and of course, Anne is much more of an expert in this space than me, but, reading the health and science sections of publications like the New York Times, like the Washington Post, Wall Street Journal, The Economist. I'm trying to be bipartisan with my sources, is a good way to really start to develop your knowledge of what's interesting to you, what are current issues that the federal government is facing and examining. And then same at the state level, one thing that I find really useful is to decide for different states which major city is the newspaper that you want to read. So for example, the St. Louis Dispatch is a prominent newspaper in that part of the country. And they often, those big newspapers, will still have good coverage of those issues. So that's another way to, to begin to learn about issues that you may want to work on more in the future.
Yeah, and I would agree with all of those. One thing I would also suggest is, particularly if you're interested at state level on health policy, is to follow maybe on Twitter some of the State House reporters. You know, those are the folks who are at the State House every day, and they'll be reporting. Some of the bigger states might have a specific healthcare policy reporter. Most of them, it'll be kind of a general one. But they will be constantly updating their Twitter feeds on anything they're reporting on. Particularly in DC, you can, I'm going to give Roll Call a plug because they're part of my company, but also The Hill is kind of another equivalent. Follow their health reporters. If you're interested in more kind of dialed in, and to go back to Libby's point about passion, which of course I think personally I was probably never more passionate as a 16-year-old as I have been later in life. And so if you are passionate about one particular aspect of healthcare, whether it's diabetes or science or whatever it is, you can really educate yourself through the large organizations that deal in that. So whether it's the Diabetes Association or whoever, they will have a lot of educational kind of materials on their websites. So if there's a particular thing that you're interested in or a particular piece of policy that you're interested in, that's a great way to go. But if you're looking for kind of a general federal health policy overview, I would say follow some of the national reporters. If you want to more drill down kind of what's happening in your state, some of the State House reporters are really good options.
Sure. So another thing, so we talked a little bit about internships, which are really important, but another, I think, tool that folks can use is what we would call the informational interview. You know, people in DC do these all the time, going to coffee, getting lunch with colleagues. And an informational interview, for folks that don't know, is really an opportunity for you to reach out to someone who maybe is working in a area that you're very much interested in, and basically saying, you know, I'm interested in learning more about what your day-to-day is like, what's on your plate, what kind of things you cover. And people often use it when they're job hunting, but you can also use it when you're in school to think about what you might be interested in terms of doing an internship later or something like that. So informational interviewing is a really important skill. And you will find that most people are quite flattered when asked to do an informational interview. And really, it's human nature, I think, to want to talk about ourselves and, you know, share our experiences. And then I would just recommend that you have, you know, a nice kind of cogent ask. Why are you reaching out to this person who probably is quite busy? What are you hoping to learn from them? And why you think that, you know, it would be useful to speak with them. So happy to talk more about that, but that's just another technique.
That's terrific responses. I would add one thing. You know, we've been talking about the substance of health policy, which is critical, but everyone in this room here really is also an expert in the political process and the advocacy process. And there are opportunities at the high school and graduate level to have experience on the process. The American Legion, the Veterans of Foreign Wars often sponsor state government process type of experiences during the summer. And also, if you're in a rural community, there are also some special opportunities. I grew up in a fairly rural area, and I had a transformative experience in high school when I won a public speaking contest at the local Oddfellows Hall. And they sent me to the UN for 2 weeks to learn about global public health. They have a very globalist outlook at the Oddfellows, and it was a transformative experience. So you don't need to leave your local community. Ask around. Often your high school guidance counselors are aware of these opportunities, your high school history and civics teachers. So there are lots of local resources that may know of some hidden jewels out there. So I'd like to jump to another question. As we're obviously in this very important midterm election. There have been a lot of public policy issues debated. I'd like to ask the panelists if there are positions that have been debated in the current campaigns that you think will continue into the presidential election. And that are there any big issues that you personally have been drawn to advocate for, especially related to health and wellness? And of course, Dora talked about the social determinants of health, which is a critically important area.
Well, I think one issue that we hear a lot about is health reform, also called the Affordable Care Act, or ACA, also known affectionately and less affectionately, depending on who you are, as Obamacare. The Republicans, since they have gained control of the administration and the Congress, have made numerous attempts to completely repeal health reform. So far, unsuccessfully in repealing it as one package. But they've made no secret that if they maintain the Congress, they may make one more attempt to repeal health reform. Certainly, it will continue. The debate will continue as part of the presidential election in 2020. So that's an issue that we can continue to hear a lot about. And certainly, there's a lot at stake particularly for patients with pre-existing conditions who, without the Affordable Care Act, would have trouble getting health insurance coverage. That's an issue I take very personally. I make no secret that I've had multiple sclerosis for many years. My monthly medication costs $5,500 every month, $5,500. And for many patients, especially, most critically, those without health insurance, there's no way they could afford to pay that much every month for a pill that you take twice a day. And so without health reform, health insurers would, and for many years did, deny people like me health insurance coverage. And so I think the stakes are high for many patients. It's very personal for many patients, and that's a fight that certainly I will continue to speak about and feel very passionately about, back to Anne's point, and why many of us remain in the health advocacy world for those very reasons.
Terrific.
Sure. So, I mean, I think, Dora, you're absolutely right. Healthcare is always going to be really high on the agenda. The economy is the other one that's going to carry through. I mean, right now it's doing well. 2 years, who knows? Not to be pessimistic, but I think opioids is another one, particularly in the States, that's going to continue. Immigration, I think that'll keep going for another while. Again, these are kind of sometimes state related more so, because that's where a lot of those, particularly opioids, a lot of the legislation can happen at a state level. Gun control is probably another one that's going to continue to be sort of a hot button issue through to the presidential election. But yeah, I think healthcare is still going to be a huge determinant based on what kind of happens in the next 2 years, particularly. And it's interesting that you talk about the cost of the drugs, because we know that there's some sort of push now with pharma. That's particularly interesting for me, because I know, coming from Europe, what particular medications cost there versus here. So it's kind of, that's always struck me as unfair on folks in the US. But that's more, again, a personal kind of.
And what you mean, so in Europe, you pay a fraction of the cost that we pay in the United States for our medications, because in essence, they have price control in Europe. So they will only allow companies to charge so much for new drugs. And certainly they pay higher for generic drugs. But we won't get too much in the weeds, but that's what she was referring to, that you'll hear even this president talk about the differences in cost of medications between countries.
I'll just add very briefly, I had made some notes, and I was going to raise the issue of the opioid public health crisis, which I think is a real big issue right now and will persist. I also wanted to mention aging and dementia as a public health and wellness issue, which I think is very important that we're addressing now and will continue into the foreseeable future as the baby boom generation continues to age. And what's interesting for me about aging and dementia as sort of a public health concern is that this is actually something that we can plan for, that we know that's going to happen. And I think sometimes our political system has a hard time planning for the future. And that's just the nature of sort of how Congress happens to work right now. But I think if anyone that's listening is interested in issues associated with aging or with kind of I mean, I guess this is my personal bias, but the neuroscience of aging and brain development and those kinds of things. I think that's a really pressing issue that we're going to continue to have to address as a nation.
I'd add one other issue. In some congressional districts, education and support for education has been a major issue. And I think, given that we talked about the health professions here, there are a host of issues related to education that need to remain on the front burner. State investment in higher education has gone down in almost every state, and it is both a social justice issue as well as contributing to health inequality. And there are specific issues such as the public service loan forgiveness program, student debt levels, investment in higher education that I hope will continue to be even get further on the front burner during the presidential election. So the last planned question we have is just to ask the panel if they have any, if they have one piece of advice that they would give high school or undergraduate students who are considering going into advocacy careers.
I can start. So, you know, I do events like this where I talk to young people quite frequently. And so many folks listening, I know just the mere fact that you're participating in this kind of event, you're engaged, you're already thinking about your future, you want to know sort of what's best and what you should be doing. And I think planning ahead is really important, but I personally want to stress the importance of keeping an open mind to new experiences and opportunities as they may arise for you. You know, you'll never know what might come around the corner in terms of an opportunity and how engaging in that experience could subsequently affect your sort of career pathway or what you choose to be interested in to work on. There's a quote by the famous scientist Louis Pasteur that I really like, which is that chance favors a prepared mind. So I really encourage folks to try to strike that balance between being prepared and having a plan, but then still being open enough to new experiences that may help you further your career development.
I love that point. I always laugh a little bit in my head when I think about that. As a liberal Democrat, this is going to be shocking for me to say, but one of the best words of advice that I think about often came from Sarah Palin, of all people. She said, as many of you may know, she was the vice presidential candidate for in 2008, and she said that when she was asked to be the vice presidential candidate for the United States, she said, "I said yes without blinking." And I thought, you know, certainly many could argue perhaps she should have blinked, perhaps there's a lot of different things, but I love that. It kind of really piggybacks on Libby's point that these opportunities will come, and there's always 1,000 reasons why you should say no, or perhaps you could say no, but to fully embrace it, just say yes and see what happens. And that's just the best part, I think, particularly in careers of policy, because you'll never know. For example, when I went to go work for the second lowest ranking Democrat in the United States Senate, that I would end up working for the President of the United States. And so I do think there's a lot of uncertainty, a lot of tortured career paths, but just being willing to take the chance and embrace what could very well be not a typical path, but will really pay out in the end.
Terrific.
Great, that's really good advice. I'm sure not everyone can get the opportunity to go to the UN for 2 weeks like Tony did, but it sounded like that was something that came about that you hadn't planned yourself, right? So to that same point of seizing the opportunities that are put in front of you, I would say get quiet, you know, and think about something that you're really passionate about. You know, is there one thing that you're really passionate about? And I think for most people in high school, if we can think back, you know, there was something that really drove us, you know, whether it was homelessness or social injustice, or maybe it's just the food in the cafeteria, whatever that is, that thing. Think about that. And if you're genuinely bringing that passion to the forefront, I think you'll be surprised the doors that'll be open. You'll be surprised at the people who will see that as a genuine thing and will be willing to help you. And don't think that just because you're one person that you can't make a difference. I mean, that's often said, but it's very true. Maybe it is the food in the cafeteria, you know. try and change that. You know, that's a great starting place for advocacy on any level. You know, figure out, I would say, set one goal, figure out kind of who the players are in that. Maybe there's a state policy that the food has to be a certain way. Don't just presume that it's because the principal likes it this way. You know, go talk to folks, and you can start your own small movement, even if it's internal or in school. You know, so I would say, you know, jump in. You know, you've nothing to lose. Just give it a go. You know, and you'll be surprised. There will be some people who will say no, but you'll be surprised all the people who will say yes to helping you too.
Great. Yeah, the only thing I would add is that there are opportunities to be advocates locally and look for them.
Mm-hmm.
Many city councils have open sessions where the public's allowed to speak. There's no age requirement on that. Let your voice be heard. Many school boards have seats reserved for students. Make sure that seat is filled by somebody you support. Run yourself if you can. So find some local opportunities to make a difference, because you can change your community faster often at the community level. And it's great training for being an advocate later on.
Mm-hmm.
So those are the planned questions we had. Now we'll try to turn to some of the questions that you have submitted. And I'd like to start with a question, a modified version of a question that Elise added here. We have 3 prominent women who are terrific advocates. Do you feel that, given that it traditionally has been a predominantly male field in the field of advocacy and healthcare, what advantages and disadvantages do you have being a woman in a field that has over tradition been dominated by males?
Like, I'm happy to go first. So certainly as a physician, now medical school classes are often 50-50 between male and female, sometimes a few more females in medical school classes. And so the field of healthcare has really, and I think that's true, certainly for health policy in DC, it's dominated by women. But where you do see differences, just for in every field, once you start to think about career advancement and promotion, that's when you see gender issues at play, and often women don't have the same opportunities historically. Certainly that's improving. So I do think that's the issue that we continue to grapple with, even salary discrimination. I think Elise also asked specifically about how as my career as an African-American woman, what's been the impact of that? And I think that, again, true for every professional field, they are dominated to some extent by men, particularly as you get more senior in the fields. And although we are seeing a lot of positive change, that will continue to be an issue. I think that there are often resources, your network of advisors, seeking out those that have gone before you and can give you advice on how to navigate certain dynamics in politics is certainly invaluable. But in the end, excellence, passion and excellence will serve you well in terms of overcoming many of these barriers. And it may not be easy, but there's nothing that's insurmountable. So I would encourage you to follow your dreams, and you will certainly succeed.
Great. Any other comments?
I thought that was a great answer.
Mm-hmm.
So.
We've had a question that I thought was interesting about what could high school students do to improve the health of their local communities. And I think Anne touched on this a little bit, but I'm wondering if you had any additional suggestions about, this is a broad, expansive view of the definition of advocacy, and it's really making change happen. And I thought the example of just the food in your own local cafeteria, there has been a wholesale change in the quality and health and nutritional value of food in school cafeterias because of the power of advocacy. I'm wondering if you had any additional suggestions.
Well, I do have one kind of example of a client, Trinity Health, who I believe are an organization that have a lot of kind of care facilities and hospitals throughout the country. I think they're like the second largest Catholic healthcare sort of provider in the country, and they have an interesting advocacy sort of grassroots thing whereby they campaign on just 2 issues, but they do it at local level and at very drill down kind of city council and municipality level. And their 2 issues are childhood obesity and tobacco 21. So it's raising the age of buying tobacco to 21 from 18. And they've been very successful at local level, getting the communities on the ground involved. So those sort of campaigns are definitely things where people are trying to improve the health of the communities. And I'm sure there's lots of other organizations doing the same thing, but those are kind of interesting, real sort of boots on the ground ways that you could certainly volunteer for organizations like that and for community organizations like that. So I think those are good suggestions for folks.
Great. Another question we've had from Kara was, how can we advocate these things without offending anyone? And I thought that was an interesting question. Do you fear offending people, or is that part of the advocacy game?
Well, I think when we talk about social determinants of health as a prime example, what we're doing now that I think has been effective is just making it routine. Talking about these things in the same way we talk about high blood pressure, if we're talking, when you go into what are your vital signs, automatically screening for what is your housing situation, what is your income level, and not making it seem like it's a question that we're not willing to talk about in the open. And I think that is helping to overcome the stigma. The same, we talked about the opioid epidemic. Again, just talking about it very openly, mental illness and substance abuse and addiction. I mean, these are chronic illnesses in the same way that diabetes or heart disease. And I think that the medical profession is starting to take steps now where we're thinking about how are we framing these conversations with our students? How are we talking about it on a policy scene without making it seem that we're passing judgment? I think that's an excellent question. It's critically important, and one that I'm not sure we're being completely successful yet, but we are taking steps towards that end.
And I guess I would just add too, I think that's a good question. Of course, we all sort of live and work in DC. Someone said earlier that this is really the one industry town being the sort of federal government and its operations. So, we may be inside what folks will call the bubble of the Beltway. But I think that, there is a recognition, and I think maybe this is what some of this question is getting at, that our political discourse right now is overly heated, overly polarized, etc. I agree with some of that, but I also think that sort of at the end of the day, facts do matter, as Tony said before, and facts and narrative combined, or data and narrative combined, are really key. And so, I work with members of both parties all the time. That's part of being a successful advocate, frankly, is being able to work with folks with whom you might disagree. And there's always a place that you do agree. And one of the nice things about these issues is that no one is going to disagree that cancer is a bad thing. People always agree on that, right? So within the health and wellness space, you have a lot of ability to actually develop, to start from a place of consensus. So I just wanted to bring that point up.
No, I think that's an excellent point. Well, we're almost out of time here, and I did want to give the panelists a chance to say any last words, anything that you wanted to add.
Well, I would just go back to that last question, and one thing I would say is, I think it's important to have the courage of your convictions, and it's okay to advocate on one side, and you can do it nicely. And I think sometimes as women, we're always trying to be nice and not offend anybody else. But you can, what's that phrase? If you don't stand for something, you're standing for nothing, or something. I'm garbling that in some way, but
If you stand for nothing, what will you fall for?
So I think it's okay to feel passionately about one side and back that up with facts, and not with emotion. And the other thing is, we see very successful advocacy campaigns when we can bring it to the personal. So back to kind of Doris spoke earlier about the woman being tossed out on the street, and after surgery or whatever, and however we might feel about that, whether we feel like she should have had better healthcare in place and why didn't she have her circumstances better to do that, or whether we just, feel a very human response to that. If you can make that personal to somebody, even to somebody who is standing on the other side of that opinion, if you can bring that down to their neighbor or, their brother or whoever it is, that's a way of kind of changing hearts and minds. So even though you might be on one side, it doesn't mean that you can't, I'm not saying that you can convince the other side, but you can be very diplomatic about sort of showing what side you're on and kind of getting some results for that.
I would just add that when I was on the Hill, one of the statements that my boss, the senator, told me was, remember that today's enemy can be tomorrow's ally.
Mm-hmm.
And you want to keep that in mind. Don't burn bridges unnecessarily in politics or in advocacy, because you may well find someone who will be your supporter on the next battle.
Right.
So our time is up, and I would like to thank our panelists. We've really enjoyed getting to know their own backgrounds and the advice they've given us on staying engaged and how to advocate on health and wellness issues and the passions that they have brought to the advocacy effort. If you're looking for more ways to get involved, join the Health Professions Week chat at 2:30 this afternoon on the Health Professions Week Twitter account, which is at Health Prof Week. And thank you so much for joining us.